Welcome to Chelonia Podcast, a podcast about the use of scientific discoveries and of technology applications. We provide the best information on projects participated by Chelonia and many more. My name is Gabriella Bernardi, I am a science journalist, and in today's episode we talk about LIGATE project with Silvano Coletti from Chelonia Applied Science. Would you please introduce yourself and tell us something about the role of your company in LIGATE project?
Yeah, thank you, Gabriella, for this question. Yes, I'm the executive director at Chelonia, known as the Chelonia Applied Science. I'm an engineer, also trained at Harvard Business School. And Chelonia is a Swiss competence center and is also a translational science institute privately held. On one side, we work with outstanding scientists and research centers supporting the boost of basic and applied research. On the other side, we collaborate with companies launching something like request for solution and want to adopt innovative technologies, or again, companies that need support in boosting their R&D platform, scaling up the readiness of the project for the commercialization, and maybe sometime also for the financing with the institutional investor. Our unique selling point is surely the scientific know-how, the knowledge of the markets, and the ability to shape the project with the aim to fit the future expectations from stakeholders. And our skills in building large network of partners and launch new concept of partnerships are largely appreciated today from applicants to Horizon Europe grants. Today, as you said, Gabriella, so we are talking about LIGATE, a public-private consortium composed of 11 partners from 5 different countries, funded by Euro HPC joint undertaking. Just to give you a framework in the international context of the project, I can say that digital revolution is having a big impact on the pharma industry and the entire healthcare systems. And the implementation of machine learning, the extreme scale computer simulation, and big data analytics in drug design and development process offer an excellent opportunity to lower the risk of investment and reduce the time to the patient. And we expect that exploiting best computing resources and artificial intelligence tools, we can also generate more effective and safer treatments, especially in neurodegeneration, oncology, genetic disease, of course, in additionally to what we are doing also in Escalate for COV. That is the project running on the same suite of application and supercomputers.
One of the ways Chelonia is supporting the LIGATE project is through dissemination activities. Can you please tell us something more about this? What is the importance of the dissemination in LIGATE project and what is the commitment by Chelonia?
Yeah, in principle, I think that the right answer for the first question, I mean, the importance of the dissemination should be that a successful dissemination plan accounts for up to 30% of the European project's final score. Dissemination is the public disclosure of the project results, and the dissemination plan aims to transfer project knowledge and results for the benefit and training of for other entities. There will be maximizing also the impact of the European funded activities. And the target audience of the dissemination plan is any entity that may have an interest in using the project result. So talking about Chelonia, the main goals we have with the dissemination is identify the result to disseminate and transfer the knowledge and result to the stakeholders that can best make use of it, identify the appropriate dissemination channels, maximize the impact of research, monitor and evaluate the effects of the dissemination activities. You have to know that the communication plan works toward raising the awareness of the project and its result, but the dissemination activities intend to make the results available for use, enabling the use and uptake by specific audiences. The commitment of Chelonia is to do all above jointly with the continuous collaboration with the members of the consortium and the external partners of LIGATE.
How will you describe such a commitment in the context of government, scientific, and general public?
Yeah, so partially I have answered before probably, but our service is extremely important because show to the stakeholders, governments, general public, and scientific community. And also we offer the continuously update with the great job that all partners of LIGATE consortium are doing.
What are the goals that you expect for LIGATE project?
Yeah, so LIGATE project runs on the platform developed by the coordinator, that is Dompe Farmaceutici. LIGATE is really a terrific opportunity for the entire community, including the pharmaceutical companies, the association of patients, the regulatory bodies, but also the policymakers. And the goals that I expect are many, and all of them, I think, impact on each of these target audiences. Surely, from the technical point of view, and I would say also at large, I think that the big goal will be the validation of Escalate, that is the fully integrated industrial solution developed by Dompe and its partners. And yes, I think that this is really the main goal that we expect from the project, the validation.
What do you think are the benefits for the European community and for the society in general?
Yes, as mentioned before, I expect a lot of impact on the European community and the society in general. We are talking of a solution that really answers some unmet need in the arena of personalized medicine. In this sense, I think, first of all, LIGATE should advance the discussion inside or among the regulatory bodies with the pharma industry with this new approach. I mean, artificial intelligence and high performance computing. And as mentioned before, LIGATE project and its software solution offer an excellent opportunity to lower the risk of investment in drug discovery and development and reduce the time to patient. So this is, I think, I would say the payoff also for the project. So we in the website we started the talking about the game changer in the drug discovery, but yes, the game changer, and probably we will talk later on about that, but it's because we grant a really reduction of the time to reach the patient with new drugs.
Do you think that the LIGATE project represents a game changer in pharmaceutical and medical research fields?
Yeah, let me go back just for a second to Escalate for CoV. So the success of Escalate for CoV project in the fight against the SARS-CoV-2 pandemic have already shown the powerful resource we can have access with this platform. So I mean, Escalate and LIGATE project, that is part of the work that we all the members are doing to validate the suite of application. LIGATE project will validate the suite of application already running in Escalate for CoV. And from my opinion, is that this is a game changer because we accelerate the activities for the design and validation of drugs, independently if you are working with a de novo or a drug repositioning approach. And the project plans, sorry, just to finish the answer to this question. So the project plans to make the platform available and open to support the discovery of a novel treatment to fight virus infection and multi-drug resistant bacteria, as well as the evolution of HPC architectures, is heading toward the specialization and extreme heterogeneity, including future exascale architectures. And LIGATE focuses also on the code portability, with the possibility to deploy the computer-aided drug design platform on any available type of architecture in order to have no legacy in hardware.
Thank you so much for joining us today at this podcast, and thank you, listeners. If you have any questions about today's show, you can get in touch on LIGATE Twitter, and feel free to subscribe to Chelonia.Swiss website and be a part of the community. In the meantime, stay tuned for our next interview.